B, Chesterfield Health District Community Health Improvement Plan Survey, Dr. Samuel.
Dr. Casey, members of the Board of Supervisors, I'm Dr. Alex Samuel. I'm the Health Director of the Chesterfield Health District, part of the Virginia Department of Health. And I am very proud to be here today to be able to introduce two of my colleagues who are accompanying me, Janice Smith, our Chesterfield Health District Population Health Manager, and Jesse Brennan, our Health District Population Health Coordinator, who are about to present the culmination of 2 years of very hard work that they have led in collaboration with many community partners. Phase one was data collection and review to determine priority health needs in this county, and we shared that information about a year ago. Today, we'll be sharing phase two, which is working with community partners to develop a plan to address these needs. So I'll turn it over to Jenna.
All right. Thanks, everybody. Good to see you all again. So as Dr. Samuel mentioned, we started this about 2 years ago in 2023 with a community health assessment. Our community health assessment is the data collection phase where we evaluate the health conditions of a community and we get direct feedback from our community residents. The community health phase and the data that we use is secondary data. So that's data that's available publicly through many different sources. In addition, we also work individually with community residents to get a granular level view and lens of what the needs are as the residents say that they are. The results of our community health assessment, we did 21 individual interviews with residents. We conducted or held focus groups with 83 participants, and we collected over 2,000 surveys of our specific Chesterfield residents. So we coupled this data with that publicly sourced data that we're able to pull. So what that looks like on a heat map, you've seen this before. This is not the first time this group has seen this map, but this is where the surveys were collected. You can see it's quite heavy on the Route 1 corridor and the North Chesterfield 150 corridor as well. We had focus group participants from the entire county. We had survey participants from all over the county. This is just where the volume of those surveys came from. So as Dr. Samuel mentioned, we took this data and we provided an analysis and identified themes that came from the data. And so we identified 3 themes. The first one was access to care, and this is access to health care. And you can see on the barometers, if you will, some of the statistics that came out from our secondary data sources around how Chesterfield relates or correlates with the Commonwealth averages as well. So we had a working group of the improvement planning process that helped really specifically hone in on access to care and how can we make changes and progress and suggested strategies to improve access to care based on what citizens were saying. And so you can see a list in the navy blue box there of some of the participants that helped us with that, some of the organizations. The second theme that we identified was mental health and access to mental health. So again, you can see some comparison statistics there available through secondary data. Again, this is not new information for this group, as we've talked about it in different settings. And so working with our small group, our working group, and you can see the county was well represented in all of these groups, but you can see the organizations that participated in this conversation to develop strategies. And then the final priority issue that was pulled out of the analysis of the data was the knowledge of resources. And what was recognized is there's a lot of resources in the county or accessible to the residents, but people are unclear on how to access those resources, where to go to get those resources, the eligibility of those resources, the language access of those, right? The list keeps going and going and going, right? And so a group that was really specifically working towards coming up with strategies to help make that easier and facilitate access for county residents. So the CHIP process took us about a year. We spent all of '24 working on that. Those small groups, those organizations, over 20 organizations represented. The county had multiple departments and agencies represented in the work as well. But you can see our timeline there. We had, this was the large group meetings. We had small group meetings where groups convened to develop and debate, honestly, strategies and objectives on how to get after the different activities. So these are the things that the group could commit to based on the scope of that working group, the Chesterfield, Community Health Improvement Plan, CHIP. That's what those letters mean. And so these are the goals that were identified as it relates to access to care and mental health. There's a lot of crossover, so combining these two groups and the strategies made sense after working in those small groups. And so you can see improving our workforce, or increasing our workforce access, increasing access to preventative services, increasing awareness of community health disparities and the impact, and we've done some of that already. Integrating behavioral health and primary care services together, linking those pieces together. And then you can see strategies for each one of those goals that the small groups came up with. As it relates to knowledge of resources, this was a pretty simple goal, is just to increase the awareness and improve the equitable access to the different tools and resources that are already available, and then some strategies that help support that. So with that, I'm going to turn it, so as I mentioned before I turn it over to Jesse, is these goals and strategies were identified within the scope of who was participating in those working groups. So some of those limitations include staffing capacities at their organization, financial capacity or financial influence within their organization, the scope of what organizations are able to do as it is and as it stands, and then just the overall influence of the participant of that group and what they were able to do on behalf of their organization. So I'll turn it over to Jesse.
Thank you. So as Jana mentioned, the CHIP process does have its limitations as far as the breadth and depth of change that is within the power of the individual participants in all of these committees. In public health, upstream, downstream, and midstream refer to levels of intervention. And the potential impact on the community. So downstream interventions help people manage existing conditions. People are already sick, we can help them manage their conditions with a downstream intervention. A midstream intervention helps mitigate the risks of people developing illnesses. And an upstream intervention can prevent health problems from occurring. So the CHIP committee, in its limitations, really was able to churn out some solid downstream and midstream strategies. However, throughout the process, committee members named and came up with a number of upstream interventions that they believe should be brought to local government leaders such as yourselves. And these upstream interventions are policy level change, it's systems level change, and it's change to the physical environment that can contribute to better health outcomes for the community. So I'm going to present the 4 recommendations that the CHIP committee has for for the board and for local government leaders. I'm having trouble advancing.
Yeah, I think it needs to be battery.
Oh, there we go. Okay. The first recommendation that the CHIP committee had was to increase the number of safety net clinics offering services to socially vulnerable and low-income community members in Chesterfield. Safety net clinics benefit communities by providing affordable primary health care services to underserved populations. Based on the data that we had available to us, we identified 2 specific zip codes that would really benefit from the presence of a safety net clinic. And that's zip codes 23234 and 23237. And for these reasons, so across these 2 zip codes, there are approximately 9,700 uninsured adults. There are some neighborhoods in these zip codes that have upwards of 20% of adults lacking health insurance. So that's 1 in 5 people without health insurance. This, considered alongside the higher than average rates of poverty in these areas, indicate a significant need for free and reduced price public healthcare services, such as those offered by a safety net healthcare clinic. During the 2023 Community Health Assessment, which is where a lot of this data was derived from, we had 450 approximate people in these two zip codes give us their input through the survey, and the numbers to the top two barriers to care were a lack of health insurance and an inability to cover costs associated with care. So there really is a significant need in these two communities. We see the impacts of this lack of care through the health outcomes. So census tracts in these zip codes have the highest rates of heart disease, diabetes, and stroke, and the lowest rates of dental checkups and preventive health screenings. And so the CHIP committee recommends that Chesterfield County consider incentivizing the expansion of existing safety net healthcare systems into the identified communities through real estate transactions, programmatic support, or ongoing operational assistance. Another recommendation from the group is related to mental health, and the recommendation is to increase free early education opportunities like Head Start in select communities. Head Start is an evidence-based program. It's proven to reduce poverty rates within participants, reduce incarceration rates for participants. It improves the educational attainment of participants, and it's also linked to significantly improved mental health outcomes for participants. The community identified that would most benefit from this is zip code 23237. If you're looking at the map, you can see a comparison between this zip code and zip code 23114 in Midlothian. So we see in 23237 that approximately 18% of children aged 3 to 4 are enrolled in school. So that's preschool-aged kids who are actually enrolled in preschool is 18%, compared to Midlothian that has a significantly higher rate of closer to 63%. In this zip code, there are 839 preschool-aged children, 686 of which are not enrolled in preschool. So while there are other areas that would also benefit from improved preschool enrollment rates, the census tracts within this zip code also have the highest rates of poverty, the lowest percentage of high school graduates, and the highest rate of reported mental distress, all outcomes which are proven to be improved for Head Start program participants. So the CHIP committee recommends that that we initiate targeted outreach to the identified community, so expanding outreach to the community using bilingual school representatives who will be able to share information about the availability of the program, make information and enrollment forms more visible to community members, and increase seats in Head Start programs. The third recommendation from the CHIP committee is that we maintain stable housing with eviction prevention strategies. We know that housing impacts health by providing a safe and stable living environment. Stable housing can lead to improved physical and mental well-being through reduced stress, better access to health care, healthier lifestyle choices, and the list goes on and on. Housing was really a big issue that came to the surface over and over in our conversations with the CHIP committees. The community of opportunity is zip code 23234 specifically. Chesterfield County ranks 5th in the state for eviction filings. And of the top 10 highest evictors, Chesterfield has the lowest poverty rate. So a situation where a community has low rates of poverty, but high rates of eviction most commonly occurs because of high housing costs relative to income levels. Because the apartment complexes that initiated the most evictions in 2024 are both located in zip code 23234 in the Dale District, residents of this district would be more likely to feel the impact of eviction protections. According to the RVA Eviction Lab, the estimated costs of responding to eviction from providing health care, emergency shelter, foster care, and juvenile detention for Chesterfield County ranges from approximately $20 million to $53 million annually. And the CHIP committee suggests that spending the money on the front end would save money in the long term. So the suggested strategies are protecting against displacement through mandating eviction mediation, increasing emergency rental and mortgage assistance to the Department of Social Services, and implementing civil right to counsel in eviction hearings. The final recommendation that came out of the CHIP committee was a recommendation to standardize social needs assessment and referral processes across local government and community stakeholders. There are a lot of people living in Chesterfield County. There are a lot of really great county departments and organizations that offer services to these people. But there is a lack of data sharing, a lack of collaboration. There are many different eligibility requirements and systems that community members are required to navigate. And so the CHIP committee recommend that we integrate standard social determinants of health assessments into the workflow of key public-facing positions across government and nonprofits. So that means we're all asking the same information about social needs, and we're sharing that information with each other, and that we work together to adopt a common referral platform. So we're asking about the same social needs, and we're using the same platform to refer residents to the much-needed services that they need. That wraps up the recommendations from the CHIP committee, and we can open it up to the table, to the group for questions.
Board members, questions or comments?
Thank you, Mr. Chair. Thank you for your presentation and all your work over the last year. I think that your comments are right on target. When I was running for office initially, a mentor of mine, Dan Gecker, asked me the question, if in the event you're in a situation where you have to make a decision what's best for Midlothian or what's best for Chesterfield, which one do you choose? And I can tell you I answered incorrectly. I said Midlothian, where the answer is Chesterfield, because where Chesterfield goes, so goes Midlothian and the rest of the districts, period. So I think that folks that are in the 23114 area code or the 23113 area code sometimes forget how diverse we are as a community. And as a result, when 68% of those folks are in and 3 to 4 years old and they're already in school, where you have 18% that are not in school, it's because of a lack of resources and how we have the responsibility to be paying attention to the entire county and what's best for the whole county. There are some folks that will say, like what Javon just said a second ago, our assessments have gone up so much. And as a result, it has gotten hard to pay our real estate taxes and all that kind of stuff. But where I'm looking at it from is what's best for the whole county, because it's either pay me now or pay me later, but you're going to get paid, as far as how important it is to take care of our entire county. So I appreciated that example, particularly just because I know Midlothian, how Midlothian is how diverse they are, how diverse we are. And as a result, we need to be paying attention to all. So thank you for all your hard work.
So I just recently was at a town hall with Deborah Gardner a couple weekends ago, and we had some daycare providers there, and they were talking about how they want to set up an appointment with me because their Head Start slots are being canceled because they're not going to be funded. And so they said that they already on their waiting list had openings only because they were, for people, they could only have so many Head Start slots. And so they could help more kids, but the kids that need the help aren't getting it because there aren't enough slots allowed for Head Start. And they also mentioned that in Dale District, there was only 2 daycare center, or preschool centers, and that's just, again, so that's the area that needs it the most, and and so, again, I think there's some kind of correlation also with our schools and how our schools do not allow, or do not appoint teachers when they come. They allow teachers to go to what districts they want to go to. I've had some conversations with some of the school board members about, so if you had a choice of teaching at James River or down in your district at one of your high schools, they're going to choose to go to James River. And so the kids that need the most help are not getting it because those teachers, they try to incentivize them to go to those other the districts that are not getting funded as well. But again, it's just so frustrating because if we have teachers, we should make them go where instead of giving them the option, because they're always going to choose the option of the lesser. And so I just think that we need to try to prioritize how we do those things and getting more early education centers here in the county. So I hear what you're saying. And it's also great to see the correlation of what Javon was just talking about and what you guys are talking about and how important it is to keep people from getting evicted and the stability needs of those kids also of getting evicted and then not having that stable household that helps them thrive when they're already underwater. So, yeah. Thank you so much.
Thank you, Mr. Chairman. I'm compelled to speak since you brought up my district, naturally. Okay. But anyway, yeah, a number of fronts here. We're talking about health outcomes, diabetes, stroke, heart disease, et cetera, access to affordable care, clinics, which will be a way to ameliorate that issue. We've talked about having a preschool here in this area. I think Dr. Case and the superintendent and I have spoken about having a preschool. We're in the process of building a new Dale Elementary School, which will alleviate the pressures. We have a lot of pressures, probably more than most other districts in terms of education. And so building a new school in addition to a Head Start program, similar to what we've already done, and those certainly need to be done. So there's a number of different fronts that your recommendations suggest that we should consider, but this is a situation that's fluid. It's not stagnant. In other words, and we need to work toward that because people move in, people move out, but still there are needs. And so no doubt about it, when you look at, as we talked about the entire county, that's how we try to look at everything from a capital program, schools, building, capital program, as well as health outcomes as well. And so when you look at, for example, just a few years ago, Bond Secure built this new facility on Route 1 in the Bermuda District. I mean, this was like a health desert. This area, right where we are, the county is a health desert. And that's why we've asked VCU to come in and to plant a site here. And so, those are things that are in play and will hopefully continue. And I don't know if you have anything to add on to that, Dr. Casey, regarding the educational outcomes, but it all starts with prevention. It all starts with prevention. And that starts with early childhood, as you well know. So definitely. I know 2 or 3 years ago, I had Dr. Worsley commission a study on daycare for this entire county. And they came back and looked throughout the state about daycare. And we didn't see a significant need for daycare in my district. I had one grandmother who needed daycare, but only one. And so we looked at that 2 or 3 years ago as to what daycare options do we need. But it's a multi-faceted approach to not just Chesterfield, but other providers complementing us and providing that.
I did just want to add to Mr. Holland, we do have CECLA already in place, and we have been looking to add another CECLA-type facility in the Dale District that would also be able to serve some of the students that are along the Route 1 corridor that wouldn't be too far from there as well. So we do have that in the works. We just, quite frankly, one of the hardest things to do is to find the location that you can do it at, let alone being able to get the capital investment in for the building, but having the location in the first place. Quite frankly, as Mr. Holland alluded to, we are looking for a location for the new Dale Elementary School that we need to put in place very badly, and that has been just as challenging. So we are looking at both of those things, which will help students in both of those, in all of those areas. So I think it's important for people to know that we are aware of it and we are working on it. Thank you. Thank you all for coming. Oh, go ahead.
I was just gonna, we're gonna distribute our full report. So this was a summary of our report, so you can add this to the binders that you already have and the other data that you have. But yeah, you'll see a report there.
Thank you.
Mr. Chair, I was just going to say that we had a program in Ettrick, and the problem was, we had put funds towards it. We couldn't keep someone staffed to actually run the pre-K program. And then we lost the ability to run it in the Ettrick Elementary School because it was not a state-certified organization that was actually running. It was a great organization nevertheless, Concerned Citizens of Ettrick, but we couldn't keep staffing, and it wasn't certified, so we couldn't actually run it out of the schools. So again, the challenge is we're still trying to work on something down in Ettrick to try and deal with this issue. So, thanks.
Thank you for your time.